Today's update covers the last 2 days here in British Columbia, so 2 time periods between April 11th and 12th, and then between April 12th to today. So we have sorry, I have to read my notes here. So between April 11th and 12th, we had 25 new people test positive for COVID-19 in BC. And then in the past 24 hours, we've had 20 new cases, bringing us to 45 new cases since our last briefing on Saturday. The total in British Columbia is now 1,490 people who've tested positive for COVID-19 in our province. That includes 650 in the Vancouver Coastal Health Region, 591 people in the Fraser Health Region, 87 people here on Vancouver Island, 136 in the Interior Health Region, and 26 in the Northern Health Region. We have no new long-term care facility outbreaks. That remains at 20, mostly 11 in Fraser Health and 9 in Vancouver Coastal Health. We have had a number of new cases in those long-term care facilities, bringing our total to 254 people associated with long-term care facilities who have tested positive, including 159 residents and 97 staff people. In addition, we have a number of community outbreaks, as you're aware of. Primarily in the interior, we have the outbreak related to temporary foreign workers and a nursery. There's been one additional positive case in that outbreak, bringing the number of people who have tested positive to 20. The ongoing quarantine and isolation of all of the people in that community, and the Interior Health is working very closely with the owners and the property owners to make sure everybody is cared for and that they're able to self-isolate or quarantine effectively. In addition, we've had, as you're aware, one case identified at the Okanagan Correctional Centre. That outbreak remains under observation. As we know, there is a 14-day incubation period, so there is ongoing testing and surveillance being done at the Okanagan Correctional Facility, but to date, only one person has tested positive, and there have been a number of negative tests in that outbreak response. The other large outbreak response that we are dealing with, we talked a little bit about on Saturday at the Mission Federal Correctional Institute in the Fraser Valley. The outbreak continues to grow at that facility. We now have 35 people in the facility who have tested positive, including 8 who are now in hospital in the Fraser Health area. So this is, of course, of great concern to us, and we've been working very closely with Fraser Health, with Correctional Services Canada, and with the BC CDC to support the ongoing outbreak investigation, as well as the infection prevention and control measures that are needed within that facility. And our priority, of course, is to protect all of those who are in the facility, but ensure that British Columbians are protected as well, and that our community is able to respond and support people who are working in the facility, as well as the inmates in the facility and our hospital system. We are working very hard to ensure that the transmission within that facility will be contained. Unfortunately, as we talked about on Saturday, there was quite a lot of transmission that happened before the outbreak was recognized, and we are now seeing people who were exposed over the previous 2 weeks developing symptoms. And there's ongoing testing and surveillance that continues in that facility. In terms of our cases here in BC, we have 137 people who are hospitalized, and of those, 58 are in critical care or ICU here in British Columbia. Unfortunately, in the last 2 days, we've also seen a number of deaths increase. We've had a total of 11 new deaths to bring our total of people who have died from COVID-19 in BC to 69. The majority of those continue to be in long-term care, and our hearts go out to the families and the caregivers of the people who have passed away over the last few months, and the challenges that we know are facing the families across British Columbia. We have 905 people who have recovered fully from this disease in BC. One of the key things that we have implemented in British Columbia to ensure that we have ongoing protection of our communities and our families as we welcome our fellow British Columbians home from where they might be around the world is our requirement for approved self-isolation plans for all returning travelers. This came into effect on Friday, April 10th. And I'm really pleased with the initiative, and my thanks go out to the many people who are involved with supporting this. The success of this initiative is really to provide the necessary supports that enable our fellow British Columbians who are returning to self-isolate effectively, to make sure that they have what they need so that we can support them and they join us in making sure we're doing everything we can to stop transmission of this virus. So since April 10th, 1,701 people have returned from around the world to British Columbia. That includes either by vehicle or by air. And we have the support systems in place and have been fully activated. 13 travelers have required accommodation because they weren't able to immediately fulfill their self-isolation plan, and 207 people have been contacted to ensure that they have what they need in follow-up. So thank you to our many partners, the many public servants here in BC who stepped up to be part of this initiative, and our partners with the Quarantine Service and the Canadian Border Services Agency. This is an important ongoing initiative to ensure that we're doing everything we can to keep our communities and families safe here in BC. I also want to talk a little bit about personal protective equipment. As you know, this has been something we have been consumed with in the last few months to make sure that we have what we need. We continue to actively source and receive supplies of PPE for all of our healthcare workers, and we want to thank you particularly to our neighbours in Alberta for their additional supply that they provided to British Columbia over the last few days. That's fabulous. We have enough PPE to meet our current demand, but we are not out of the clear yet. Many of you have also made very generous donations, and we want to thank you for that. And but to remind people that the best way for you to donate or to offer services and products is through the Supply Hub that has been established, and you can go to Supply Hub. And that is an important thing for us because we have a team of people who are able to make sure that anything that is donated meets the specifications that we need, particularly the medical specifications. Even N95 respirators are not all created equal. They are made for many different things, and some of them that are used in industrial settings may not be appropriate for the medical setting. So through the Supply Hub, we can make sure that these are all tested and they meet the specific specifications that we need to be used in the healthcare system. But we want to thank everybody for their ongoing efforts and contributions in this area. Finally, around weekend travel, we have asked British Columbians to avoid non-essential travel, and we have received many questions about BC ferries and about other travel options. I think it's safe to say that we have been united in keeping our firewall strong across this province. And BC Ferries continues to report more than 80% decline on travelers on all of their routes. So that is something that reassures us. But I do want to say there are many reasons why people may need to travel. And essential travel is still required to keep our province going, to make sure that we have the food, the medications, the things that we need in all parts of the province. Goods and the people to deliver our services still need to move. Many students as well are now returning home as the semesters have ended for our universities, and that is an important thing for them. I also know many people live and work in more than one location, and that means at the start and the end of their week, they may need to be on the road. But I thank you all for doing what you can to limit your need for travel. And everybody whose efforts to stay home and stay safe and keep a safe distance from others over this weekend. So today actually marks our 50th public update since this crisis began. And it's a key part of how we are trying to keep you informed and make sure that you know everything that we are doing, and that we all have the information that we need to take the actions to protect our families and our communities. And Minister Dix and I remain committed to maintaining these updates for as long as they are needed. It is so important for all of us to keep going with everything that we are doing now. It is holding us, it is holding our line, it is allowing us to deal with these issues in a way that is the best that we can do for our province. We'll keep going with our updates and with our 24/7 provincial response on this issue for as long as we need to do that. And I'm asking you as well to please keep on the line, hold that line, keep doing what you are doing. And especially for our youth and our young people and our children, remember, this is not forever, but it is for now. And what you're doing is making a difference. So thank you for doing your part with kindness and with care.